Does medical or Western medicine now embrace and use Eastern or other non-Western traditional approaches such as acupuncture, herbal medicines, etc. in pain assessment and management? I think that'll go across the entire panel here.
Yes, I am an acupuncturist. I don't know if you knew that, but I trained as an acupuncturist because to treat pain of my patients. I don't do acupuncture too much here in Canada because I don't have time, but in Brazil when I was practicing medicine, I was a medical acupuncturist. And I believe in acupuncture, massage, adjustments to treat musculoskeletal pain. Although the evidence is not so strong, the recent studies have shown that acupuncture, if you do acupuncture, real acupuncture in the meridians, in the real points, you get 40% of pain relief. But if you do outside of those points, you also get 40% pain relief. But if you do nothing, so they compare to a group that didn't receive either intervention, you don't get pain relief. So we really don't know what is the mechanism behind the acupuncture. They say that it could be a placebo, but how could a placebo give 40% pain relief that lasts hours or sometimes days or even months? So there is no explanation. The same thing with massage. We know that massage helps with specifically muscle pain, but it's expensive. Not a lot of people have the means to do massage once a week or once every 2 weeks. We know that adjustments that are delivered by chiropractors or osteopaths, they also give some relief, especially in the spine when the pain is in the spinal origin. However, again, they are not covered. They were delisted. Physiotherapy and chiropractic were delisted from the Ministry of Health payment in 2004. So if you decide to go to physiotherapy to do your treatments in a physiotherapy clinic, you have to pay, unless if you have an insurance or if it was a work-related injury. Which is unfortunate because a lot of patients get relief from these interventions, and they don't have the means to continue doing it. So the government pays for the opioids, but doesn't pay for the physiotherapy, massage, acupuncture. So guess which one is easier?
Any comments, Beth or Sandra?
I guess I'd just say, even though I'm a pharmacist, yes, I'm a strong proponent of non-pharmacological treatments. I think that medications are not the only answer, and may not be the answer for some people. Yeah, I guess that's...
The biggest thing with alternative medicines often is the cost. As Andrea said, massage therapy. In Kitchener-Waterloo, it's $80 an hour. And if you go to a homeopath and they prescribe something, this is a lifelong illness. So can you afford $100 a month for the rest of your life? Can you afford that much? And sometimes, unfortunately, it boils down to finances. And what works for one person doesn't work for the other. So it's a trial and error for you. So you have to try your alternative along with your Western medicine and figure out which piece of the puzzle works best for you. Do they work together? And be honest with yourself. If it says it cures everything, then be wary because there's not too much that cures everything. So, again, the education component, do your research, figure it all out, talk to your friends, talk to your family, your team, and figure out what is the best for you.
I guess the other point I was going to make was that in addition to the sort of non-pharmacological, more physical therapies, what we find in some of our patients who are having pain and addiction issues, that therapy just helping to cope and deal with the pain as well, helping to get strategies, more psychological therapies around the actual pain disorder, and learning to cope and non-pharmacological options on that, and can be really helpful for our clients as well.
I had a philosophy professor at Mac in undergraduate who held Descartes personally responsible for the bizarre approach that Western medicine takes to people by creating the mind-body dichotomy. I don't know if anybody here ever took Albie Shalom's courses on psychological philosophy, but it was fascinating to see somebody who was that passionate about a dead philosopher But he held Descartes personally responsible for many of the problems in Western society because Descartes separated the mind and the body. And one of the things that we come to recognize and have come to recognize is that pain needs to be treated in the context of what we describe in Western words as a biopsychosocial model, but which is treated in some other philosophies as the whole person or holistic medicine or treating the patient in their own environment. And I think that's one of the things that we tend to lose in some of our approaches is that we forget that people live in a context and they have relatives and they have friends and they have a job, hopefully on their good days, and they live in a city which has certain things going on with it, and they have to do certain things from day to day. And so your treatment of a patient will be defined by that. I would hope that when people look at alternative treatments, they apply the same intellectual rigor that we try to apply in the use of so-called Western medicine or our prescription medicine or our use of surgeries. So in order to be released as a medicine in Canada, you have to go through although potentially imperfect, a pretty demanding process of demonstrating that the compound you're selling actually does what you say it will, that it has minimal side effects compared with the alternatives with that job, so it can't make people more sick, and you should have demonstrated that over a period of time, it doesn't make people more sick and it does what you say it will. And preferably it does it better than the alternatives currently available. I have huge anxieties about purveyors of snake oil, which sometimes people are, who have, now Buckley's mixture of course is right off, and that is an excellent product. And not to be classed with those snake oils that some of the other, like Smith Brothers, now what do they know about cough stuff? But there are definitely completely outlandish claims, and I think they have to be treated with the same, so if you go to your physician and you say, well, wait a minute, if I take this, what good effect will it have, what bad effect will it have, and how long am I going to have a therapeutic trial? Then if you go to the holistic medicine purveyor, you should be saying, okay, what will be the good effects, what's the bad effect, and what is an appropriate trial? If I go to my acupuncturist, we actually run an acupuncture training course from the Department of Anesthesia that Angie Babjak and Alex Loriega have been running for about 15 years. Angie's been doing this for 30 years. Is looking at the physiology of acupuncture and what it does, how does it work? And so if you do that, you have to try. Does it actually do what you think it will, and have you given it a reasonable trial? I like to get smokers because I can argue with them and I can say, look, cigarettes, what are they now, like $15 a deck or something like that. And so if you can get somebody to quit smoking, they can buy almost any health care they want once a week. I mean, if you're smoking a pack a day and you cut that out, you got $100 a week to play with for alternate therapy. So, that's kind of fun. It's mean, but it's fun.